Hey, thank you for joining us for the Local Loop today. The Local Loop is an online conversation with community leaders as they work through the difficulties of navigating the COVID-19 pandemic. We also want to use this time to help keep you in the loop as to what's going on and what resources are available. Each episode, myself and Bryan, the lead pastor of Oak Ridge, host local community leaders and business leaders to see how they're navigating through this time and what you need to know. And today we're really happy to have Dr. Glenn Hornstein of PRMC. Dr. Hornstein, thank you so much for taking some time out of your busy schedule to meet with us today.
Oh, my pleasure, guys.
You know, I can't imagine what it's been like for you guys over there and the staff and PRMC. Hey, would you mind kind of telling us what your role is at PRMC and what it's been like for you during this time?
You know, I'm the medical director of the emergency department at PRMC. And it's been somewhat surreal. You know, it's, I guess, a pandemic is not something that we've experienced before. You know, we've had, times when we've had, influenza and other things, but never, on this like sort of a global wide outbreak. So it's something that, we've prepared for. I want to say, especially in the emergency department, these are things we're always looking to prepare, again, for emergencies, for the worst case scenarios. I can actually say that I'm very proud of the staff. I think overall, like we've done a great job. We have, everyone in the department from EVS to techs to nurses, registration, APPs, physicians, consultants, even us going all the way up to the hospital administration. I mean, I think everyone's responded appropriately. What we're doing is we're trying to do what's in the best interest of the community, of the patients, also doing what's in the best interest of the staff. We don't want anyone, to get unnecessarily, infected, or have any sort of, bad outcomes. We're trying to do, everything possible we can, again, to save lives and protect people. We're, reaching out to, other, healthcare, workers. This is something that's just so, different. It's something so new for each and every one of us. And I mean that, across the nation and across the world. And so we're just trying to learn from one another. Everyone's sharing experiences. There are lots of webinars. There are lots of, virtual, discussions. There's lots of data. We're just trying to gather data and try and make decisions. There's lots of things that we're learning, and then, we're basing on anecdotal, cases, and we're implementing, hoping that we can, improve care for the future.
Well, Dr. Hornstein, and I would say that what we have seen in our community and social media outlets, we service about 5,000 folks through our outlets. And so what we've seen over and over again is people saying PRMC is knocking it out of the park in responding to this pandemic. So thank you for what you're doing. Thank you for the hospital's response. And I know you guys have gone way above and beyond to be proactive in preparing for the wave. And so thank the Lord, we have not seen quite the wave. I think as of this morning, I saw there was 87 confirmed cases and still just the one confirmed death from coronavirus. And man, that's great stuff, but it also says a lot to the response. And so I know you've seen the cases. I know they're actually coming in. So the fact that we've only had that one death means that, in fact, they are receiving great medical services. So one of the things I just wanted to ask you a few questions in your role as a physician. I know you're not a disease specialist, and but you are a doctor, and so that makes you far above our pay grade in understanding some of these complexities that, frankly, we're having to consume. We, as regular citizens, we normally don't have to think about a lot of these things, but now we're being forced to. And so a lot of questions around this are coming up. So let me ask you a couple of these and see how you feel. Why is corona, or maybe it's not, in your opinion, why is corona something we need to care more about than the flu? Why is this something that we would say, oh, this is much more dangerous than the flu? Why the big response, whereas we certainly deal with the flu every year?
It's just this is a new virus. I mean, that's why they call it the novel, coronavirus. It's something that, there are other coronaviruses that are out there. I mean, there are 7 different types, but it's just, the way it's affecting people. I mean, literally people are getting infected and then they're getting sick. There's a certain patient population that gets sick and they're getting sick quickly and they're dying. And we're just seeing, the effects of this virus, that much more than we are seeing, the flu, that you get the seasonal flu and people, we were prepared for it. And then, you get the flu vaccine and then people, you're protected, and there are some drugs that, can actually, improve the flu symptoms or the time course of the flu. There's nothing that we have out there in our armamentarium right now that actually is being able to treat or really, effectively treat, at least that we're seeing, the coronavirus.
So a lot of it is just the fact that this is so new.
It is.
That there's so much that we don't know, which that brings up another question. And I know, I know you're not a prophet or the ability to forecast in the future, but the thing is, we're hearing different leaders in the community and in the nation, and in fact globally, with different opinions about when we can go back to life as normal, quote unquote. And others are, a lot of the medical community saying, well, guys, got some bad news. And so what I'm hearing estimates of, really, we're not going to return to normal for maybe 1.5 to 2 years in the cycle of having to have a vaccine in order to really genuinely return. What are the factors? What do you think
it's
going to return?
It's an unknown. To be honest with you, Bryan, it's an unknown. And I'd be really kidding you if I gave you, hey, we're going to be, back to school, we're going to be back to normal in a month or 2 months or 6 months. It's sort of like there's going to be a new normal. Okay. And that's just reality. When things happen, whether it be 9/11 or now this pandemic, the world changes and you adapt. And so.
But would you say that the indicators of that are more important? Like, would you say that really truly having some sort of vaccine is more important than guessing a date? That would be a trigger that would help us to say, okay, now we could probably safely move back into community gatherings.
It would if they can develop a vaccine that it would be perfect, and that would be like a great answer until that day comes, and it's just really hard to say. You know what I mean? It's like there are lots of questions. Again, schools are closed. Offices are closed. Businesses closed. It's just one of those things that you're trying to find that medium where you're like in the middle of the road where you're not putting people's lives at jeopardy. You don't want to put people at risk, but people also need to work. Kids need to go to school. When I have 2 boys that are at home and they're doing virtual classes and it's they're canceling SATs, they're adapting the way they do AP exams. I mean, things are changing. Everything is changing. Will it be back to the way it was before? Or are people going to still have social distancing in mind? It's hard to say. I mean, it really is hard to say, because what happens if you suddenly go back to the way it was 100%, and then it starts up again? No one knows exactly what's going to happen. We're trying to do what we can to again limit disease, limit the spread. When you were talking earlier and sort of saying how PRMC has done a great job, I mean, I almost have to say, yeah, I agree with you, but I think the community's done a wonderful job. People are listening, and to me, it's a team. We are all in this together. This is not just whether it be PRMC or any other local hospitals. It's all of us. It's the community, and I really, really, really have to say, community has been just so wonderful and supportive, and they've done everything that they're asking. And hopefully, as we work together, we're going to get through this. I mean, I have no doubt we're going to get through this. It's just it'll change everybody a little bit, but that's okay. You know, we can adapt. That's not a problem.
Yeah. You know, it kind of speaks to, you know, I know we're all hearing it, but you kind of said it there about our community. Talk to us a little bit. I mean, it is about the importance and how important it is for us to follow these guidelines, the coronavirus guidelines. I mean, I don't think we can hear that enough. How important is that we continue to do that?
You know, I actually think it's extremely important. And, you know, it's unfortunate because this isn't something that you're going to go and you can look and say that person has coronavirus, you know, COVID-19, and that one has COVID-19. We're seeing such, you know, we're seeing people that are coming in with the fevers and the coughing and, you know, the respiratory symptoms, but then you're seeing other people who are asymptomatic. So again, you don't, you know, you can be infected and not necessarily, you know, be symptomatic, and you could actually already be having the virus, or you're going to be shedding or spreading the virus. So it could be, you know, 2, 3, 4, 5 days. And so we're seeing people that are asymptomatic, you know, that are getting screened, you know, if, let's say if they have a certain procedure that's being done or whatever, and then they're positive and you're like, oh man, or they come to the ER and they're coming for one type of a thing, and then it turns out then they come back with symptoms, you know, like 3 days later. Well, most likely when they were here before for that complaint, it may have sounded like it was not related, but we're not sure. Maybe it was a little bit related. It's hard to say.
Mm-hmm.
You know,
that points to the big controversy that a lot of folks are talking about, and that's testing. So testing is being talked about all over the country, and we're hearing a lot about 15-minute tests, and sometimes we hear about 45-minute tests. And so this idea of a 15-minute test, is that available in Wicomico County? And if not, do you expect that you will eventually have access to a 15-minute test?
So testing is just one of those things that you hear everyone talking about it. And the truth is, and I'm saying this like across the United States, if we had tests and we could test everyone, that would be perfect and that would be great. The problem is that the testing that's available in the United States, there are hotspots right now for, you know, COVID-19. You have New York, you know, you have New Jersey, you have Michigan, you have Louisiana. And so you have a lot of the testing that's actually getting prioritized to, you know, different parts of the United States. Now, we are getting testing here. So I'm not saying we don't have tests available. We just recently, okay, I want to say like, you know, literally within the week, that we actually got a rapid test available here. And it's a 45-minute test. So the test is actually a 45-minute test, but we did not get a large number. We're hopeful that we're going to get more, you know, test kits available, and we'll be able to get that, you know, quick 45-minute test. The way the testing actually works is initially when, you know, this pandemic started, at least for us, we were sending tests out to the Department of Health, you know, the Maryland, you know, State Department of Health. And then there was another clinic that we were also sending it to. And it would take days, you know, and so with everything that's happening with, you know, COVID-19, understand literally, and this is what we sort of talk about all the time, and I'm always emailing, you know, my staff, okay, you know, my physicians and my APPs, everything literally can change. Everything happens quickly. It can change in a week. It can change in a day. It can change even in an hour. I might say something to them, and if we find something else out new, we might actually change something, you know, and it's always for the better. But as far as testing, we now are starting to test more, you know, patients. But again, you don't just test someone to test them. Right. There needs to be an indication to test. So there's a little bit of a, you know, misinformation that people sometimes are like, I just want to be tested. You don't just want to be tested. If you're symptomatic, you're tested. The majority of people, you know, we weren't testing initially because it wasn't going to change their management. And this is one of those things I try and explain to people. I'm not going to just do a chest x-ray on you just to do a chest x-ray. If it's going to change my management, if I'm going to admit you, if I'm going to then decide to give you an antibiotic or do something different, I will get a chest x-ray or I will run a test. But, you know, you can sort of say if it's flu season and someone has flu-like symptoms, well, guess what? You probably have the flu. You know what I mean? This is the way we've always been trained. You know, so to send a test, is it really going to affect your management?
Gotcha.
Does that make sense?
Yeah, yeah. And I think that also, one of the things that I've wondered about is that, okay, let's say I test this week and it says I'm negative, but 2 weeks later, I've been exposed. And, I guess
Exactly.
because this is such an evolving thing that it
Right.
makes sense to me, at least in my mind. I love what you said, that we should test if I'm going to make a decision based on the outcome.
Correct.
I think that's a phenomenal stance to help people to understand. I know we would all like to be tested with, you have to have, I don't know, 350 million tests available, but then that would only be week one.
Right. And the other problem, Bryan,
many more.
But Bryan, the other problem is the test is not 100% sensitive. So what happens is you can test someone, and remember, there are different parts to a test, right? So like if you're doing, and these are nasal swabs, or deep nasal swabs. If it does, and it's a little bit painful, but if you do it, and if you don't get the proper sample, okay, then maybe it might be a false, negative test. And again, it's not 100% sensitive. So if you're part of that, and people, I've heard different numbers, it could be 98% sensitive, or it could be 88% sensitive. But again, if you're part of that 2% or 12%, and I say to you, Bryan, you don't have COVID-19, and then you go and you aren't being, it gives you a false sense of security that I don't have it, and you go and you shake hands with someone, and you're scratching your face, and you're then spreading it. So that's why, honestly, it's like, if someone, again, if they have symptoms, we're saying that you may have presumed COVID-19, and just use good, hygiene, good, self-quarantine instruction as best you can. Like I said, we're going to get through this. It's just going to take time. We're just didn't want to, as a country, the surges that happened in the states that I had sort of mentioned earlier, it just overwhelmed the health system.
Yeah.
And if you can actually sort of flatten that curve and make it so that only, so many patients are coming to the hospital at a time, the hospitals can deal with it. And that's why, like I said, it goes back to, what I've seen, when I go out in the community, when I need to, I try and stay home as best I can. But when I'm out, I think the community is wonderful. Absolutely wonderful. People are polite. People are distancing. It's been great. It's just been wonderful.
So maybe the best way to self-manage is pretend you got a test. Pretend they said you're asymptomatic, but in fact you have it. So act like you have it.
Yeah, we don't want to make people, sort of crazy, about it, but we want people to just, you just want to use good judgment, you know what I mean? And so, like, the judgment that we'll tell people is, look, you seem like, again, this is even before people, now they're going to sort of mandate masks, starting this weekend, across the state, when you're out, in public, you just don't want to be, again, practicing poor hygiene. You want to, good hygiene, distance from others, and then hopefully at some point in time, we're going to see where this virus is going to sort of, really go away.
Doc, one last question, and then, we may have two real quick. But the first one, how are you? You guys are the front line. You're going in almost to the fire every day. And how are you guys doing? Mentally, how are you taking care of your mental health, you and your staff? And I know this has got to be, stressful for you guys, and you're working a lot of hours. How are you guys taking care of your mental health through all this?
Bryan, that's a great question. Again, it's one of those things where, like, in emergency medicine, you are, preparing and at work, and you're in the right, mindset. This is a little bit different because even when you leave the hospital, you're thinking COVID-19, you see it out there. You're wearing your mask, you're social distancing. The world, again, is different. It's one of those things where I try and, tell my staff, okay, and I know, I hear, nursing saying the same thing, other administrators saying the same thing. You got to take time for yourself. You know what I mean? You really do. I could say that I've personally watched a lot of good movies with my family. okay, we've taken, it's time to catch up. It's, maybe, this is an opportunity for us, as a society to really get back to family and spending time with your family, and that's what it's really about. It's important. What's sort of nice is, to see the creative ways that people are at least acknowledging others. I have neighbors who talk about, they're doing the Zoom meetings with their families and, the virtual, get-togethers. Saw someone who, one of our neighbors, people drove by in a car just to wish them happy Easter, honk the horn, put a sign out. It's connecting with people, but not necessarily physically. It's, by phone, reaching out to people, telling them that you're thinking about them. It's been really nice. I've had a lot of family and friends who have texted me and given me phone calls that they're thinking about us. It's been nice. It's been really nice. But I think the bottom line is you can't think about this 24/7. You really, to be healthy, watch a good movie, read a good book, not related to pandemics or outbreaks or COVID-19. You know what I mean? Do something, have fun. This is still a time when you can have fun.
We had a segment with Dr. Michael Finnegan from Peninsula Mental Health, and his key theme was self-care. You gotta take care of yourself. So I'm glad to hear you guys are doing that. Bryan, did you have another question before we wrap?
Yeah, the last thing is just we've been asking each of our participants. We reached out early on to PRMC and asked them, what's the best way? Because we like to ask people the best way to serve you rather than just to show up. And so we called, and they said the best way is funding the frontline worker meals. And so we put together our church congregation has put together a special offering, and we'll be sending money, and hopefully that will help you guys in some way. But just know that we certainly are lifting you up in prayer as well. What do you think, in your opinion? What's the best way that faith communities can really support and help the medical community during this pandemic?
I mean, it's basically everybody keeping the faith and realizing that we're going to get through this. I mean, that's really, what people can do is just, have hope. Okay. Again, we're going to get through this. It may seem like a downtime for some, but, hopefully 10 years from now, we're going to look back and we're going to say that this made us stronger. This made us smarter, wiser. Keep doing, everything, the whole community, should be doing the same thing. Again, the social distancing, the good hygiene, at the end of the day, like I said, we're going to get through this. We appreciate, I know there are lots of organizations that have been doing donations, meals and stuff. And we appreciate it. Please, if it's not been said, we appreciate it. Is it necessary? It's not necessary, but we appreciate it. We know that everybody's thinking about us, and we're thinking about everybody. I think for me, and I sort of, tell, friends and family and staff and stuff, there's a light at the end of the tunnel. Okay. It's not an oncoming train. It is sunlight. It's out there. We're going to get there, but it's just going to take time. Just be patient,
That's a great word. And that's actually was the theme of my message for Easter. The title of my message was Hope Wins. And that's the message of Easter. Easter is that death doesn't have the final word, and neither will this pandemic. And I love the fact that you said we're a community, and that means we're in this thing together. And so thank you so much for what you're doing. And thank you for being a part of that overall community that is fighting against this pandemic. And thank you for giving us this time.
Oh, guys, it's been a pleasure. My pleasure. Thanks so much. Stay safe, guys.
Thank you.
God bless.
Thanks.